Hello, Strong and Well community. Monday Movement RX. Today I'm going to be talking about lower back. So lower back tension, nagging sensation. When I bend over, it's not feeling good, it's uncomfortable. When I wake up, I feel so tense in my lower back. So I need to move or do something to reduce that tension. So if that describes you, then you might fit the new category in our modern world, which is called non-specific lower back pain. And that's basically, in a nutshell, when there is no structural damage and there is nothing like particular that is found in your structure, but you still have that discomfort, that kind of achiness and all of that in your back, you might fit the category. But we're not gonna talk about the pathology or something is wrong with the body. So we're gonna try to explore if we can bring some change, some healing properties, some nourishment with some intentional movement. And today I'm gonna be talking to you about one of the most fundamental movements that I teach my clients all the time. And I cover this in more details in my online program. And the movement is the pelvic tilts. So this is gonna be the pelvis tilting forward, creating that anterior tilt, more of a scientific term, and the archy back. And also posterior tilt, so pelvis moving backwards and creating that rounding, kind of pushing forward. So there's all variations of that. So the pelvic tilt is very important to connect with because it shows up in all other compound great movements, just like squatting, deadlifting, or just hinging at the hips and picking something off the floor, maybe when you're bending and putting dishes in the dishwasher or things of that nature. So it's a very fundamental and very functional movement. So that's why I cover this quite a bit in many different variations and go a little bit more in detail in my online program. So without further ado, we're gonna be trying to connect with that motion. For today, I'm choosing the position on hands and knees, so if it's not comfortable for you to be on hands and knees, there are other variations, and again, I cover them in my online program. So from here, I can show you, I did lots of yoga many years ago, and I was just going through the cat and cow motion, kind of like unintentionally. You just move. You move, wherever you go, move. So this basically was my thing, extension, and you can see how I can extend so much through the lumbar spine because I have that mobility, but my upper back does not create any extension because what I'm doing here, I'm just sinking it down, squeezing the shoulder blades in, and I think or hope I am extending or creating that change, that healing property in my upper back, but I wasn't. And during many years of yoga, I did have some lower back pain because I was exaggerating one motion more over the other, and that was basically it. So, and again, it's a lot of extension through the lumbar spine, and that's where I kind of lived for many years. So I did have that nagging pain quite a bit here and there. So now we're gonna try to move with intention a little bit. So we're gonna try to create intentional movement through our lower part first. So I'm gonna try to keep my upper body not moving, and I'm just gonna try to bring that tailbone down and under, rounding the back, and then bringing the tailbone up. And again, notice how I'm trying to use my core muscles so that I don't just let myself sink because I can, right? And this is just creates quite a bit of tension in my lumbar spine. So again, just nice, small, gentle movements. The pelvis it's not designed to move a lot. So this is that hip movement. So now I'm gonna try to keep my lower body not moving. So I'm using my pelvic bones and I'm kind of like pulling them in towards the center using my core muscles to keep my lower portion not moving much. Obviously I cannot create 100% isolation, but I'm trying. And this time I'm going to try to push the hands into the floor and round, bringing my forehead towards the pubic bone. And now I'm going to try to pull my hands towards the knees to create the arc. So I'm lifting the chest forward and up and creating the arc, which creates that extension through the vertebra of the upper back. So again, it's not just sinking down and using the shoulder motion to create this arc, which is primarily done in the lumbar, but I'm trying to create the arc that is creating the extension through my thoracic spine. And here's the thing, so because I neutral curves, the lumbar spine is created to be archy, right? That's why it's very easy to create an arch through the lumbar. And if you don't create relative stiffness, relative stability around other places, then the lumbar can move basically for anything you want to be arching. So, and the upper back is created to be rounded. So that's why it's easier to create that rounding through the upper back. So that's why we want to work for extension in the upper portion, and we want to work for flexion in the lower portion. And obviously how far you are extending in the lower portion, it's going to take you a very small gradual progression to create tolerance for that flexion, the rounding. So like for me, after I realized what was happening with my spine, after doing all that yoga that I was doing, it took me a few months to create tolerance in my lumbar spine to just feel and be okay with that rounding, and also use my core muscles to create that, because my core muscles weren't really working because everything had to go into back and work. So I know it might be too much information, but just trying to give you the overview and give you an idea how I present this fundamental movement to my clients. But we do go through lots of steps, and again, they're going to be presented in my online program. So now I'm going to try to combine this entire movement, and we're going to try to make this intentionally. So we're going to do it slowly and deliberately, and you're going to try to stay connected with your sensations and feeling what is happening, like what is moving and what is not moving. So from here, I'm going to try to bring my tailbone down and under, rounding. Then pulling my navel in and up toward the spine. Then I'm going to use my hands actively to push the flow away and create the rounding. Bring the forehead towards the knees or pubic bone. And then from here, I'm going to slowly start taking my tailbone up toward the ceiling. Still creating a little bit of core engagement, so I'm not going to sink into my hyperextension. I'm going to use my hands to gently pull them towards the knees, creating the arc through the chest. So I'm pushing the chest forward and lifting it up at the same time. So I can feel how my spine creates a very fluid motion from my lumbar all the way into my upper back, and then also the head. Because a lot of times what happens, what I usually see in classes and when I assess my clients when they come for my first assessment session, so it just does kind of like this. So where nothing moved here and my head moved back quite a bit to give me that full sense of extension, right? So, and you might think like, well, why is it happening? So should we just like spine? That's the question that I always ask, like, well, shouldn't just like move the way it's supposed to move? Well, it is, but when we always move kind of one way more than the other, so the body adapts to what we do the most. And most of the time we do sit, and this is basically a movement. And then, for example, you know, I was sitting, and then I had to go and do a lot of that. So basically my sit was kind of like that as well. So that's why whatever we do the most, and if we don't intentionally present other opportunities for our body to experience, we become not so in tune with it. So that's why that mind-body connection that allows you to feel like where you are in space. It's that skill of the proprioception. So when I started doing this movement with intention and doing it slowly and deliberately, I actually noticed my area of the body that wasn't moving. Then I started to really move that area with intention. And after a while, after a few months, so it took me a few months, I stopped experiencing any nagging lower back sensations and actually started to feel really, really good in my lower back to actually create that rounding and stretching. And finally, I also realized that I have the core muscles in the lower portion that need to work. So I put them back to work, and that created a relief. That created nourishment healing property. And then when I started loading or bringing strength training, my pelvic motion and my awareness of that motion was already there. So I could safely and progressively load or strengthen now the muscles in front and in the back. So here's your fundamental movement for today, movement Monday RX. And this is lower back relief, lower back release, and just making lower back happy. And this particular skill has worked wonders for most of my private clients that I have. So try it out. If you still struggle with it, not sure, because it can be like a mind-blowing, send me your video and I'll be happy to evaluate your movement and give you some pointers on where I see you might want to focus, and I will send you another evaluation video feedback, so you will have it right in front of you. And it always helps when someone else kind of gives you that the second opinion, whatever the other eyes looking at you. All right, so be strong, be able, be well, and keep creating healing and nourishing movement for your body so that it will respond to you in a more positive way and stay with you actively for the next chapter in your life. Happy Monday.